Dr. Armstrong, thanks for taking some time for us here.
Thanks for having me.
The chapter on dementia and Indigenous peoples states that colonization is a root factor of dementia risk. Can you explain how that works?
Sure. I think it's been well recognized by various people in public health that there are a range of different social determinants of health, and when it comes to Indigenous peoples in Canada, colonization plays a key role. In the report, we use a model that really uses a tree as an analogy to show how at the root of a lot of health outcomes are factors like colonialism, and that they have a role to play in health behaviors, education, income, and other aspects of life for Indigenous peoples.
What barriers are there in getting a diagnosis and receiving care for Indigenous peoples with dementia, and what's being done to alleviate that?
Well, it's quite complex, especially if you're not living in large urban centers. It might be challenging to find specialists or healthcare providers that can provide that diagnosis. So I believe there is work being done to try to improve that. We're also seeing new tools that can be used by physicians that are based in various languages, but also provide a better approach from an Indigenous perspective. And these are tools developed by Indigenous peoples and researchers within Canada.
What's something you'd like people to know about dementia?
Well, I think I'd like people to know that while age is the primary risk factor for dementia, as you get older, you increase your risk for developing dementia, but there are a range of actions people can take to lower their own risk, whether that comes from lifestyle choices like more exercise, better sleep, better diet, but also working with physicians to make sure that your health issues like diabetes, high blood pressure, hearing loss are all addressed. These factors together can lead to higher dementia risk. So if we try to actively go against those risk factors, we can lower our risk and hopefully have better brain health later in life.
Dr. Armstrong, important study. Appreciate you taking some time for us here today to talk about it.
Thank you so much for having me.